Welcome to Let's Clear the Air, a podcast sponsored by the Allergy, Asthma, and Sinus Center, dedicated to educating listeners about allergies, asthma, and immunology.
Welcome back to Let's Clear the Air, all things allergy, asthma, and immunology. I'm your host, Liz Edwards. Today, I am joined by Dr. Paul Carter, one of our board-certified allergists, and we are talking asthma, and allergies go hand in hand for a lot of people.
Yeah, Liz, it's true. In fact, we see what's called the allergic march in early childhood. So kids often start with some nasal and or eye symptoms. They may develop skin problems like atopic dermatitis or eczema, a lot of people call it, which is an itchy skin condition of childhood mostly, but we see it in adults as well. And then later, you can progress on to having asthma symptoms. Sometimes that's quite rapid progression. Kids will go from becoming allergic to having asthma very quickly. Other times it takes a few years to kind of go through that progression. They may not develop their asthma symptoms till they're a little bit older. And there's some other things involved in how that happens. But we do see that allergic march, that we call it, because it's all very closely related.
What do telltale asthma symptoms look like in a child? I mean, I feel like when you're around kids enough, I mean, they cough for various reasons, but what would telltale signs be that it should be looked at more intentionally?
So there are several things that you could be looking for. One would be that you hear actual audible wheezing, or the cough sounds very wheezy when they cough. So that would be a sign that it's more of an airway thing and not a throat thing. Okay. Also, if they have episodes of shortness of breath, where they seem to be having trouble catching their breath, especially if you see what we call accessory muscle use. So you might see the dip in the bottom of the throat kind of caving in at times, or the areas, especially in children who are thinner, you can see the area between the ribs sucking in when they're trying to take a breath, or a lot of abdominal motion can be another sign of difficulty breathing. So very young kids, you can see that a lot easier than the older kids, but you'll see it at any age. And then one of the other things, as kids get older, that might be a clear sign would be they're running and playing, but they have to stop frequently to catch their breath, and they're not able to keep up with the other kids. Or after running and playing, they're coughing a lot. Those are signs that they could have some asthma as well.
So if I am suspecting my child has asthma and we come to see you, what would a first office visit look like? How would we start to narrow down where to start on treating these symptoms?
Yeah, so the first thing we'd do is we would talk through all of that history and do a good physical exam, and that can tell you a whole lot, especially if it's been recent that the child is having symptoms. We should be able to find things on exam that are consistent with having asthma. Sometimes exam can be normal, and as kids get a little bit older, we can do some breathing tests that can help us determine whether or not asthma is actually what's going on. In really young children, they're not able to do those breathing tests because they do require some coordination with the test in order to do it. But as kids get older, we have that extra thing that we can do. Kids sometimes may just have these coughing spells and wheezing spells recurrently with colds, or when they're around certain things like cats. And then that's a really strong clue that it's asthma, even without having to do any further like mechanical testing like breathing tests. So we could try a trial of medication that would control asthma and see if we get a good response to it. That's another way for us to be able to come up with the diagnosis.
And then would you necessarily launch into further testing to see if there's other triggers as far as, is it the pet? Is it the weather? Is it, whatever's out there environmentally?
Yeah, particularly if there's other symptoms like recurrent sinus infections, recurrent ear infections, lots of nasal drainage, sneezing, those kind of things. That would be a very good clue that there may be some allergies And so we would do some testing for a lot of the things that would be in a child of that age's environment. So
Hmm.
the younger they are, the fewer outdoor allergen tests we do and concentrate more on those indoor allergens like cat and dog and dust mite.
Hmm.
Um, and as they grow older and have more allergies develop, we begin to expand some of those things and do a few more outdoor things, like some more of the pollens that might be present, like trees or grass or weeds. Even though we do a few of those at any age, we expand that as people get older.
What do you think all of this does to someone's quality of life before and after treatment? Like, tell me some of the successes that you have seen after treating patients.
Most important thing is being able to do the things that they want to be able to do with
Hmm.
no reduction in the amount of it that they can do. For instance, kids who want to be outdoors playing and running and doing things and being a normal kid, if we're treating them appropriately, can go do all those things. They don't have to be protected and kept in a bubble and keep them in the house and not be able to do the things that kids do. So if we treat them appropriately, they'll be able to go out and play and do things that they want to do. They'll be able to be in school more regularly and not have to stay home from school. So just think of it as the normal activities of daily living that often kids who have severe allergies or asthma are not able to do. Now it opens up the door once they're treated to be able to do all those things again and to be normal kid again.
You have a lot of tools in your toolbox, from medications all the way up to biologics, which people see commercials for on TV. Can you speak to that, like the levels of treatment that can be offered when it comes to asthma?
Yeah, so for asthma, if you really just have some intermittent problems and it only comes a few times a year for a day or two, we can even just be on an inhaled medication to bronchodilate the airways and help them to be able to breathe again, as long as we're not doing that frequently and they don't require a lot of more significant medicines like steroids. That may be all we need. But
Hmm.
as we start to get more severe and symptoms are more frequent and require more often use of that rescue medicine that we're talking about, the bronchodilator, then we start to need to add in a daily medicine at some point to help prevent the recurrence of symptoms since they occur more frequently. So we use inhaled medications to do that. Many times those are a very mild steroid that doesn't cause systemic symptoms, like we worry about from taking recurrent shots or oral medications that can be mild enough to not do that, but still, since we're applying them directly in the airway, can get rid of the inflammation, swelling, and mucus production that's causing the symptoms so that you don't have to use that bronchodilator so often, and so you could go do what you want to do and feel well.
Hmm.
Then, if that's not working and we're applying that, but it's a severe enough case of asthma that they're not responding to the inhaled steroid medication, we can add a long-acting bronchodilator to that. And if we don't get control with adding the steroid plus the long-acting bronchodilator, that's when we would next think of the biologic medications that people often see advertised recently on TV to
Hmm.
add in to help control the asthma at that point. Because now we've done almost all of the things we can do that are in our tool belt for controlling asthma outside of the biologic, which we could add at that point. If the allergies or the asthma are a little bit milder, not requiring the biologic medication, but they're controlled well with the inhaled steroid medication or the inhaled steroid plus the bronchodilator, then we can do things to try to help reduce the need for the daily use of medications by controlling our environment for the
Hmm.
things that we're allergic to, and then for putting patients on shots for allergy to help reduce their allergies so that eventually they don't react so strongly to the things they're allergic to, and we can remove some of the medications that were required to control it because it's not as bad anymore.
This is, at least listening to you talk, I think like this is the most natural way to start to heal your immune system. like from where I sit listening to you talk about all of this. Would you agree, or like, what is your take on just allergy and asthma in general? Like, you don't have to suffer. There are so many different ways to treat and really improve overall quality of life.
Yeah, so the way our immune system, for those of us who have allergy, sees the allergen is as an invader. Just like
Mhm.
the immune system might see bacteria as an invader and have a response to it, we often can see in those of us who have an allergic tendency the pollen or cat dander, dog dander, mold spores as an invader. The difference is that the type of invader that they think of when they see those things is like the same as if it were a parasite. And so we have a little bit different response than we would to a bacteria.
Mhm.
We don't make a big neutrophilic response. We make something called an eosinophilic response. A type of white blood cell called an eosinophil is what's drawn to the area to attack the invader. And that causes all these symptoms like um, cough and wheeze and shortness of breath, increased mucus production. And so we're trying to downregulate that response by teaching the immune system to ignore those particular stimulators, those allergens. So we give people a shot of what they're allergic to in extremely tiny doses and gradually build up that dose to a dose that suppresses that immune system response to those allergens. And then when you're exposed in the environment, you no longer have that big reaction anymore, which causes the cough and the wheeze and the shortness of breath. So we don't get that big inflammatory response like we formerly did before allergy shots.
This is so helpful and such great news. And for our listeners out there who are suffering, they need to call immediately and make an appointment. Allergyasc.com is where you can do that. And you have just offered so many tools and solutions today, Dr. Carter. I thank you for that. And we just want people to know that there's hope and you don't have to live with the status quo.
My pleasure, Liz. Thank you.
We hope you've enjoyed this episode of Let's Clear the Air. Please consider following this podcast, and remember, if you want helpful and accurate information about allergies and asthma, our allergy experts are here to clear the air.